Are you looking to add clear aligners to your practice in a way that decreases stress and increases success? I'm so happy talking with Dr. Lopez, someone who's added clear aligners to his pediatric practice. My name is Dr. Paul Nacho Goodman. I've been using Evenly in our practice, key resource and sponsor of Dental Nachos, to help our patients feel better about their smile, have more fun. Dr. Lopez, thanks for being here. Share with us a little bit about your experience with Evenly, adding clear aligners, and your journey with your team.
Absolutely. Well, I can say a lot of, there's such great benefits about joining Evenly since last year. And it's really added a lot of excitement in the practice. And a lot of it has to do with our patients wanting to keep their services really much in-house. So that's something that we really wanted to incorporate and hasn't really been lacking for a long time. So when Evenly approached us and mentioned, hey, this is something that we can do together, that's something that we got really excited about, and everyone's pretty much on the same boat right now.
Love that. Now, I'm an exhausted but enthusiastic practice owner. I call myself a medium-age dentist, Dr. Lopez. That stands for MAD, because sometimes so adding new things to our practice is not easy. And what I've been impressed by is how Evenly really does it in a really awesome TLC way with their treatment coordinator and their scanners. How's that been in your practice? Walk us through what happens. You're a pediatric dentist. You recommend this consult. Walk us through this process a little.
Absolutely. So it starts with basically consulting with that child. So we bring the patient in, and the parent usually comes into the conversation as well. So we tell them that little Johnny needs to basically have a phase 1 or a phase 2 orthodontic treatment, and we believe that an aligner therapy is maybe just as good as even superior than traditional braces. So they're getting excited about it because they read a lot of these things, online, and a lot of things that you'll find on social media. So from that consult, we basically schedule a consultation for the child and the parent to return back. And that's where one of our excellent TC treatment coordinators will come in and swoop them in and basically get their case started. So it really goes with the scanning, explaining everything from start to finish, and really guiding them from what their case will be from the beginning and to the end.
And this is what a couple of things I've noticed as someone who treats patients of all ages and stages. We have an older population. One, people don't cancel their Evenly appointment because they want to look better, right? So it's funny. I recommend an implant. I don't want to come filling. So what I found in adding Evenly to our practice is that there's an excitement with the patients in wanting to not only have their teeth work better, but look better. But, their treatment coordinator from Evenly, we have had the awesome Kelly, comes in and does everything, scans the teeth, does the treatment plan. I find it to just be very relaxing for me in a day that's not always relaxing.
Exactly. So what you mentioned it very well too. I mean, when we also have the luxury of having Kelly here as well. So she does basically take a lot of the stress that we normally would if those responsibilities were put on a certain staff here. So what she does really well is she welcomes the patient in and really gets them in from, again, the beginning of the stages that will require that TLC all the way till, pretty much delivery, where we get their aligners on and
And what I like about this is it's also really responsible. So we know that some DIY orthos, a little bit nacho nuts. So you're a pediatric dentist. I'm a general dentist. Sure. I don't have a tremendous ortho background. So I'm really impressed on how responsible Evenly is, because they have an orthodontist helping plan these cases. You as a specialist, tell our audience about that, because, sometimes momentum is lost by people learning new procedures because they don't know how to troubleshoot or they're not sure how to bail out. So how's been your experience with working with Dr. Hickory and his team in planning these cases?
Well, this is what I find. You're a general dentist. You know a wide spectrum of procedures, and you're good at them, right? So as a pediatric dentist, we've learned to really take care of a lot of the needs of the kids, really behavioral, pharmacologic, and all these good things. So our training is very limited to ortho. So I find that if we're good at what we're doing, whatever it is, it's probably best to keep it that way and leave the experts to what they do as far as straightening out teeth, and leave it as that. So that's what I find as Dr. Hickory, with his expansive experience, that will basically deliver. I mean, there's never a way, that he's not going to be able to deliver that he would.
This is what they're doing every day. What I find kind of amazing, just in my starting of this, I'm in my start to it like you are, but the patients are interacting with the app with Dr. Hickory, asking questions. One of our most awesome patients excitedly shared a video of how her teeth are moving already. I want to know, I'm 43. All they did was just strap on these braces, and a year and a half later says now they're off. There was no check videos. There's just me getting made fun of a lot, right? So I find that to be cool because they're bringing the patient into the fun of the care.
Right. And I think a lot of the success of this process is once you get them excited and you incorporate their involvement from the beginning, I think they're best able to have a better, more successful outcome.
Right.
So
yeah, they're engaged and they're accountable in certain ways. And, you know, they're using the app, they're asking questions. I find it to be really what dentistry should be more about, where the patient is just truly engaged with the process. And how have what ages of patients are you treating mostly with this? 8 to 12, 8 to 16?
I would say it ranges. So of course, you know, with the AAO, the American Association of Orthodontics, recommend an evaluation at age 7. So usually about 7 or 8 is when I know is a good time to really send someone out for a consultation. In our case, we'll send them out to Evenly. So I would say between 8 and, you know, I would say early teens.
Yeah, and so I want to share with you, I don't know if you want to go back to dental school and do the joy of making dentures and partials. I'm not sure. Do you want to do that, Dr. Lopez? I'm going to guess.
Sure, if you want to. I mean, like, the fun thing I like about doing that, just mounting those teeth in there. So that was the fun thing about it.
It's joyful. But we have a patient who's 12 years old using Evenly clear aligners. And we also have a patient who's 65 years old. So what I want to share with the general dental audience is it's kind of a way to embrace so many different patients at ages and stages. And people, what I found is people are coming in as adults who would have never considered traditional braces. We've told them about this before, and now they're excited because they know through clear aligners they can do this. So I appreciate you sharing on your end as a pediatric dentist. Sure. Me, I have the whole circle of dental life. So you know our dental people, Dr. Lopez.
Sure.
We're not the easiest of people with change, right? We don't change very easily, right? It's not us. So talk to a pediatric dentist out there who's thinking, I don't know if I want to do this. Why should they just find out about how to incorporate Evenly into their office?
Absolutely. So the first thing that you want to ask yourself is there something that is absent in your practice that you could provide to your patients? And in my case, if it's orthodontics, which I do not do, that's something that is a market that you're going to tap into if you really find ways to incorporate that into your services. You send it out. But if you find a way of keeping it in there, Evenly does that beautifully because it does incorporate a way where it does not disturb the flow of your practice already.
Right.
You said, you know, you got a great TC that comes in that will start everything. It's like very stress-free. So, and that's what they want to do, deliver that almost to any Evenly center. So anyone that might be questioning or wanting to incorporate something, this is a great option to really have something like this injected into their practice.
You've said it perfectly because, you know, they don't talk about this enough in dental school. We have to be profitable and we have to be patient-centered. So this is a perfect way to do patient-centered, profitable care. You can still work with your outside orthodontist. Not every case is going to be done, but it's just a way to add, to use a nacho metaphor, a topping on your nachos in your practice.
Exactly. Yeah.
That's fun. You know, one of the things that I liken it to is a lot like early whitening, right? Bleaching your teeth. It's a fun thing to do. It makes you look better. This has a fun and function to it, but a lot of the things we do aren't fun. So why not give our patients the opportunity? I don't know if this is the way you say it, but a lot of people are doing these post-pandemic glow ups, Dr. Lopez, where they're trying to look better, you know, get their hair fixed, get their teeth fixed. So why not give them the opportunity to do this? So I appreciate you sharing with us. How could someone reach out to you if they say, I want to learn more? What's the best website for them to learn about your practice? They just want to know about the Dr. Lopez Pediatric Dental Life.
Well, they go on my website, www.pediatricdentistalexandriava.com, or they can basically give us a call at 571-257-5744.
Awesome. I so appreciate you sharing. I appreciate Evenly being an awesome key resource and sponsor. For my crew, if you just text Evenly to 215-543-6454, you will get the opportunity to learn, to just find out how you can add this to your practice. I'm glad I've done that. I'm very appreciative of Evenly for supporting Dental Nachos as a sponsor and also just spreading a lot of positivity in dentistry. So thanks so much for being here with us, Dr. Lopez.
You're very welcome. My pleasure.